What I invite women to do is to think about having the conversation with their partner. Could there be a world in which they actually sleep in separate beds? And, when I say that to women, they often give me a strange look and say, well, I can't do that because I don't want a divorce or what's called like a sleep divorce. And I say, words matter here. We're not talking about a sleep divorce. What I like to think of it is like a shared sleep plan, right? If you communicate with your partner saying, sleep is really important to me. I find that I might see sleeping better alone in my bed. Can we try it out for a period of the work week, a few nights during the week? It's all about communication and explaining that it's coming from a place of trying to optimize your sleep, not a reflection on them or your relationship.
Welcome to Stronger by Design podcast. I'm your host, Michelle MacDonald, and today's guest is Dr. Woganee Filate. I had to practice saying her name. She is known for her work around sleep, her speech around no more sleepless nights, how women can reclaim rest and health in midlife. And this is so topical, especially for me as a physique and transformation coach. Sleep is a real issue, especially as we get older for women. And it doesn't have to be. Today, we're going to break one of the biggest blind spots. I really do feel this is a blind spot in women's health, sleep. What if your sleepless nights weren't just part of getting older, but the silent accelerator of aging itself, right? So I want you guys to change your frame on how you're accepting this lack of sleep. My guest is Dr. Woganee Filate. She's a physician, she's a researcher, she's co-author of the Essentials of Clinical Examination Handbook. She's a champion and advocate for women's health, especially around sleep. She's published in leading medical journals, spoken on the National Menopause Show stage and about reclaiming rest, and she's redefining how we think about sleep in midlife. In this conversation, we're going to unpack what really happens to women's sleep through menopause, what the science actually supports, and the strategies that can help you restore energy, balance, and health span starting, hopefully, tonight. Welcome to the show. Let's get started with some core themes. Why is sleep the missing pillar, in your opinion, around women's health?
Yeah, so I'm very biased, obviously coming from a sleep background, but the science is so clear. Sleep impacts every single metric of our health. It impacts our brain health, impacts our cardiovascular health, our mental health, our quality of life, metabolic health. You talked about bone and muscle health. It really is the through line through all of the components of our health. And we need to bring it to the fore. Because it is a passive activity, it's a passive process, we often don't think about it, right? We just take for granted, I'm going to go to sleep tonight and wake up the next day. But we really need to prioritize it like we do every other aspect of our life.
How do women's sleep challenges differ biologically and even socially compared to men?
So it's a great question, and this has actually been looked at. So interestingly, objectively, women are technically better sleepers than men. We tend to fall asleep faster. We often are sleeping longer, have higher what we call sleep efficiency, meaning the amount of time you're asleep when you're in bed. But subjectively, we report that our sleep is worse. And there are a lot of theories for why that might be. Number one, women may have a stronger need for sleep or a stronger sleep drive. And the other is we are challenged in many other ways that men are not. We have increased care responsibilities in the home. We are carrying many different hats. So our sleep isn't as restful and restorative as the numbers would have us believe.
I'm sure there's women listening to this and they're just in total disagreement, like that can't be true. I don't know how many nights where my husband literally is hitting the sack, their head hits the pillow and they're snoring. Can you explain that a little bit?
Yeah, so I think part of the issue is what's being observed in research and what's being observed in real time. So the research is you're taking a woman outside of her home, measuring her in a sleep lab. I mean, if you did that to me and I don't have to worry about anyone around me, I probably will sleep better. But in reality, we are living in our bodies, our changing bodies. We have people or our partner or pets, kids in the bed. So there are many other real life challenges that make our sleep not as good as as some of the research would lead us to believe.
That is an interesting point. I never even thought of that. right? So you get out of that environment. I know my pets sleep with us, and when I'm struggling to sleep, I'll go to the spare room and I pass out instantly because the dogs aren't with me. And I can't believe I'm saying that because I love the dogs so much, and I think that they're quite soothing from a sympathetic nervous system standpoint, but
They're big sleep
they
disruptors.
are
Yeah.
interesting. And then we've got the male body oftentimes sleeps at a different temperature, right? Which can affect
And I
our
see that
sleep.
a lot, with my patients. And this is one of the things I give them permission to talk about in their homes is to really think about if you are doing all the right things, you are putting your screen down, you are, not having caffeine or alcohol late in the day and prioritizing your sleep, but the person beside you might be on a different schedule, it can often be very challenging. So, what I invite women to do is to think about having the conversation with their partner. Could there be a world in which they actually sleep in separate beds? And, when I say that to women, they often give me a strange look and say, well, I can't do that because I don't want a divorce or what's called like a sleep divorce. And I say, words matter here. We're not talking about a divorce. What I like to think of it is like a shared sleep plan, right? If you communicate with your partner saying, sleep is really important to me, I find that I might see sleeping better alone in my bed. Can we try it out for a period of the work week, a few nights during the week? It's all about communication and explaining that it's coming from a place of trying to optimize your sleep, not a reflection on them or your relationship.
Interesting. I'm gonna tease that out a little bit more. So number one, what is the link? Can we talk about that? Like, what is the specific link or the data between insufficient sleep and long-term health span? Do we have numbers for that?
We do. And in fact, it's not only time of sleep, but sleep regularity. So, the two most important objective sleep metrics that have been correlated with long term health and reduced mortality are getting the right amount of sleep, so 7 to 9 hours every night. That includes weekends, and sleep regularity, meaning you want to be going to bed at the same time every night and waking up at the same time the next morning. And that can be challenging. We have often many people have a different sleep routine during the work week and a different routine on the weekends. So it's really just trying to keep that in mind. I'm not saying don't have a social life, don't go out and enjoy yourself, but when you are able to have more control over your sleep schedule, to really think about those two parameters.
Yeah, I want to talk about food. I like to say you've got 35 meals, one or two of them have fun, but the other 33 or 34, make sure those are ticked off. And that's a great way to have that balance between having some fun, but making sure you're getting that regularity with your routine. So like same kind of idea, right, for sleep? Okay.
100%, 100%.
So I know that, and I talk about this with clients that have shift work. I know that shift work has been classified as is it true a carcinogen or?
It is, yeah. So the World Health Organization has come out saying that chronic night shift work has been a probable cause of cancer. So it's a probable carcinogen. And the data comes from large cohort studies, typically in nurses, that show with a minimum of 10 years chronic night shift work, you do see an increased risk of breast cancer.
Interesting. Okay. And it's probable though. It's not causative. It's like
not
saying
causative.
there's
That's
an association
just what they're
between
saying.
that. Yeah. Okay.
Yeah. But when we look at the role of sleep in our immune system, it's actually not a huge surprise, right? Sleep, we need our immune system like every other system in our body to rest and repair. And when you are working against that chronically, you can start to see some biologic abnormalities.
Do you also, when you're working with your patients, start analyzing like the totality of, allostatic load, and then whether or not they can recover or be functional with reduced sleep? Do you educate?
Yeah, I mean,
that?
what I say to patients is the number one key metric of how you're sleeping is how you feel. Right? A lot of patients try to show me various wearable data and they, are tracking their sleep in apps and et cetera. And that's great because there definitely is a role for that. But if you subjectively feel that you didn't sleep well, regardless of what your metrics say, that's an important data point. And we have to be honest with ourselves. Even though we think, or 10, 20, 30 years ago, I could have survived on less sleep, but now as I'm older, I actually need more sleep. We need to give ourselves that grace to say, you know what, I actually need more sleep than I did even 10 years ago, 5 years ago.
Yeah, and that might change depending on how much other environmental stress that you have going on in your life.
100%.
Recovery happens when you're sleeping. You want to grow muscle and
100%.
you're training hard. Well, guess what? You're going to need to clock more hours likely because there's a larger load from a physiological standpoint for your body to regenerate that tissue. You're ripping it down and you're eating, you got to build that muscle.
100%. And the same could be true about brain health too. So there's evidence to say that when we're sleeping, the brain undergoes a very sophisticated cleaning mechanism. It's like, it's like a dishwasher rinse cycle for your brain. During the day, as we're awake and doing lots of cognitive load, we build up debris, for lack of a better word. So proteins and extra cells that the body needs to clear out during sleep, and a particular part of our sleep cycle. And we know that when people are chronically sleep deprived or not sleeping well, we have a less ability to clean up the brain. And those deposits tend to happen in places of the brain where we see changes regarding Alzheimer's disease.
Cognitive decline. Okay.
Yeah.
Right. So we've got immune, right? So some of the negative, like we really want to get serious about sleep. It's not just about getting your beauty sleep, right? We've talking about immune system can be impact, and this is research-based, correct?
Yep, correct.
Potential, negative health outcomes. So we understand this association with how the World Health Organization is rating chronic shift work. We have cognitive health and potential connections to cognitive decline if we're not getting that quality or quantity of sleep. Some other things you add in there?
Another big one I would think, especially for women, and as we're going through the menopause transition, is the role that sleep has on our metabolic health. So we know that when we don't sleep well, we are more likely to be insulin resistant. Our risk of diabetes goes up, and the hormonal milieu from a gut-brain axis is impacted. So there are hormones in our body that tell us to eat, and there are hormones in our body that tell us that we're full. When we're not sleeping well, that imbalance is off, where our hormone that tells us I'm hungry is higher. And so that is stronger playing in your brain the next day after sleep deprivation. And the types of foods we go after are well known: salty, calorie-dense foods. They've even done studies that showed chronic sleep deprivation can increase your daily calorie consumption between 300 to 500 calories a day, which, I joke with patients, on a 1 or 2 day basis doesn't seem like a lot. Maybe it's a cookie, maybe it's a croissant. But if you do that every single day for a year, that could be up to 15 pounds of weight gain. And that is quite significant because it increases your risk for cardiovascular disease, joint pain, etc. So the sleep and the metabolic link is a huge one.
Why do you think sleep problems are dismissed or underdiagnosed in female patients?
Yeah, I think it's part of a larger problem where women's health, in my opinion, is deprioritized. I think, number one, women were not routinely incorporated into research studies in the medical community until, mid-90s. I remember the 90s, right? So it doesn't seem like it was that long ago. So to really think that women were not actively recruited into studies until just, many decades ago. So we don't have a lot of data. Number two, the default in medicine is the 70-kilogram male, right? And so all the lens that we look through on diagnosis, on treatment, on prevention is through that lens. So we really need to, as a society, as a medical community, is really ask the question, I need sex-specific outcomes. I need to know how this impacts women specifically. Our biology is different. And then the other piece is sometimes caregivers may not always have this on their radar, that a woman's sleep is different than a man's. So for example, in my domain, one of the disorders I see often is obstructive sleep apnea. And for many women, by the time they've come to see me, they've gone through multiple, assessments, and no one has said, well, could this be sleep apnea? And that's because women in midlife will often have a different, what we call clinical phenotype. So a different collection of symptoms and presentation. So classically, when we think of sleep apnea, you think of a male who's overweight, who has a thick neck, who snores and chokes at night. Women, the symptoms can be more subtle. So things like headache the next morning, irritability, impaired concentration. And so it's not often on many clinicians' radars. The other thing too is a lot of women often feel it's taboo to report that they're snoring, right? That it's like this unladylike thing. I don't want to tell my doctor I'm snoring. And then the other piece too is women often present to medical appointments alone, right? Whereas typically men will come to a medical appointment with their spouse. I'm generalizing. But how that is relevant is that if you have someone else who is like your sleep witness, as I call it, they can really help the clinician have a more complete picture of the patient's behaviors at nighttime. Whereas women, when they're by themselves, may not have the anecdotal information from their bed partner to provide to the clinician. So I think the issue is broad in scope, but also there are even, individual patient related factors why this isn't something that many clinicians have on their forefront.
Would it be true to say that there's a lack of education amongst doctors around sleep issues, particularly for women?
I mean, I think there is a lack of sleep issues related to women's sleep specifically, and then how it changes during the menopause transition. I can give you my story. I did all my training at the University of Toronto, well-regarded medical school, did a pulmonary medicine fellowship, did additional sleep medicine training, and not once in the subspecialty year, especially in my sleep training, was I ever asked or taught about how sleep changes for a woman. I never asked until, many, many years ago when I started to educate myself. I never asked a midlife woman, are you waking up from hot flashes? Are you waking up drenched in sweat? I'm embarrassed to even say it. And that's because that was never part of our education. And it was only when I started to connect the dots, seeing trends in my patients, that I then stepped aside and did additional research and reading and self-education, that I did see these links. And, thankfully that happened to me because now I'm a very different clinician than I was, more holistic, more targeted to women. And, I try to encourage my colleagues to do the same.
I think I was presenting a lecture and I came across some data that was talking about the trickle-down cascade of information from current research down to the practitioner level. And it was something like, I don't know, it was in the teens. So I'm going to say 13 to 16 years to trickle down. And so what we're seeing right now, of course, is practitioners, whether it's a doctor or a nurse or, even a physiotherapist, that they are also relying on things like AI or and influencers, and that has to change too. So
for sure. And I think patients are more educated now, right? Then this is a different patient population, like to your point, access to social media, rightly or wrongly, access to AI. Patients are coming to their medical appointments very informed. So as clinicians, we need to do our part. The patient is coming informed and prepared. We need to do the same.
Let's dive into the midlife sleep crisis because, it gets a little bit tangled here, and it's important that we understand the nuances to untangling what's going on with sleep in midlife, because it's easy to just want to throw hormones at things, but that might not be appropriate. At the same time, there's this heightened awareness that there are these hormonal shifts, and hormones might be the best resolution for certain key things. So I'd love to talk about that a little bit. Let's talk about the hormonal shifts in perimenopause, menopause, and then post-menopause, and how that might impact sleep.
For sure. This is a great area to talk about. So we know that our hormonal changes during midlife, especially during the menopause transition, have a huge impact on sleep. But the hormone piece is one piece of a bigger puzzle. I like to think of sleep changes in midlife into 4 categories, or 4 reasons why why I call it like our life is like a Vitamix blender, where everything is mixed up together and we don't know what's what. The hormonal milieu is a big one. As estrogen levels go down, our sleep is disrupted. So, estrogen has quite a number of roles in our sleep. It's responsible for the production and secretion of serotonin, a really important neurotransmitter for sleep regulation. We know estrogen plays a big role in regulating our core body temperature. So, we need our body temperature to drop a few degrees in order for us to get into a deep state of sleep. We also know that estrogen plays a role in consolidating REM sleep. And REM sleep is the sort of one of the last phases of sleep you get in the night between 3 a.m. and usually 5 or 6 a.m. That's important for emotional processing and emotional regulation. As estrogen levels go down, that REM sleep is often fragmented. So it's very easy to be woken up. Many women will say they wake up 3 o'clock, 4 o'clock, like clockwork every night, and that's a big one. Progesterone also plays a huge role. Progesterone itself as a molecule has calming effects. We also know that it plays a big role in non-REM sleep, so the other half of sleep that we get. As we go through menopause, actually, our melatonin production goes down. And it's probably one of the first sleep changes that we see scientifically where the melatonin production goes down as early as our early 40s. And melatonin is our chief sleep hormone. And then in terms of the hormonal and physiology part is our changes in circadian rhythm. So as we age as women, we tend to be what's called phase advanced, meaning we want to go to bed earlier and wake up earlier. So that's one piece of the hormonal milieu, the physiologic changes that are happening. The other piece is actually the menopause symptomatology. So we know that there are over 30 symptoms of menopause. The classic ones, hot flashes and night sweats, are a big sleep disruptor. There's even data to suggest that a woman is having a hot flash, like physically recorded in her skin, and her sleep is disrupted, but she doesn't even report the hot flash. So you don't always have to be woken up to have it disrupt your sleep. Another big one is mood changes during the menopause transition. We're more likely to be affected by symptoms of depression or depressive mood and anxiety, and that impacts our sleep. And finally, in terms of the symptoms of menopause is the genitourinary syndrome of menopause, which are related to changes in the vagina, the vulva, the urethra, the bladder. And that can actually impact our sleep. You might have urinary incontinence. You might have to go to the bathroom many times at night. You may have itching and discomfort in the vulva. And so that can also disrupt your sleep. The third bucket relates to what we were talking earlier about new sleep disorders. So that would be my job as a sleep doctor to make sure there isn't a primary sleep disorder, whether that be sleep apnea, restless legs is a big one, and chronic insomnia. And then the final fourth bucket is sort of our life stage, right? There's a lot going on emotionally, psychologically at this time of life. We are trying to progress in our careers. We are dealing with children that are aging. Many women are having babies into their 40s, so they may be having young children while having perimenopause at the same time. So many, changes in our life, and all of this is happening at the same time. So it's like a perfect storm. It's like you said, it's a sleep crisis for women. But the good news is, with a care provider who really is thoughtful about all of these different features of why your sleep is impacted, can really help.
So this leads us into the next piece. But before we do that, we are in we're definitely in a healthcare crisis, right? It's, especially in Canada, it's very hard if you don't have a doctor to find a doctor. It feels like, all the good doctors are gone and you can't get in. I have clients that are very afraid of their doctors retiring. They've been with their doctors forever, and they're really worried about, how am I going to find a new doctor that will really be able to give me that quality of care? And I think in the States, it's actually not that different. Most of my clients actually have resorted to private health care. So how, what can you do to work with your doctor and make sure you're coming in with clear symptomology, that you're making sure that you're educated and that you're not getting overlooked or dismissed?
I think this is a really important point, and there isn't an easy answer, but there are things that patients can do right away. I think number one, you want to, like to your point, you want to record your symptoms, right? And really have them itemized in terms of what are the symptoms that are bothering me the most. I mean, in one physician visit, we can't address everything. So pick maybe your top two symptoms that are most bothersome. The other thing is, I think it's helpful to let your doctor know in advance that this is what you're coming in for. So, if you wanted to talk about menopause symptoms or sleep changes, let the booking system know, send a note to the medical team letting them know I'm making this appointment because I want to talk about menopause. I want to talk about my sleep. And it will give your doctor the opportunity to perhaps do a little bit of research, do a quick lit review, go online, see what the latest guidelines are. I mean, your doctor wants to help, right? It's not that they don't want to help. They're under the same pressures like the rest of us, time crunch, seeing multiple things in a day. And it's not easy to always be on top of every single new change in medicine. So kind of front end loading that so your doctor can be as prepared as possible. And, make follow up appointments. Not everything can be addressed in one appointment. So take away one strategy or one thing that's going to get addressed and then make appointments to keep going back and reporting whether that worked or not.
Would it be appropriate to ask for a referral to a sleep specialist?
100%. I think if you're really struggling with sleep and, the doctor has, looked for what I call low-hanging fruit, making sure there aren't any, abnormalities in your blood or your other medical conditions well controlled, then I think it's well within your right to say, you know what, thank you for all the work that you've done in helping me get here. I do think I would benefit from a referral to a sleep center. And I would be hard-pressed to find a doctor that would say no. I mean, the issue then becomes it's now you have to find a sleep specialist in your neighborhood, in your community, and oftentimes there's long waits. But at least you get the process started.
Is there a possibility for telemedicine here?
Yeah, so there is lots of role for telemedicine in sleep and any other domain. The one piece would be regarding sleep testing. So part of when patients come to see me, in addition to taking a thorough history, physical exam, looking at blood work, I often will send patients for a sleep study. So that can be done, at least here in Canada. We send patients to a lab where they sleep overnight and get wired up, and that's the gold standard measurement of your sleep. If that's not available in where you live, you can talk to your doctor about doing a home sleep study. It's a very good screening tool, and if you screen positive, oftentimes that can accelerate you to get into a sleep center.
I'm just thinking of your earlier comment that the data might be skewed because women are getting into the sleep center and they're passing out because their dogs aren't there, their kids aren't there, their husband's not snoring. And I can see them going, I don't understand. It's the first good night of sleep I had.
And I often hear that a lot, especially the patient population where I hear that a lot are patients with insomnia. So these are patients who say, I can't sleep. I don't sleep at home. I sleep maybe a few hours a night. How do you expect me to sleep in a sleep lab? And I tell them, I just want you to do the best that you can. And the reason why these sleep studies are still valid, even in 2025, is because once we notice that your brain is asleep, so we have very characteristic brainwave patterns, we know that you're asleep versus awake, all of the physiologic parameters that follow, so your breathing, your heart rate, your blood pressure, et cetera, that doesn't change. So, if you get a great night of sleep in your sleep study, that's amazing. It gives me more data to look at to really see if you have an underlying sleep disorder. I don't actually need a sleep study to make the diagnosis of insomnia. What I do is to see if there's something else that I'm missing. So the sleep studies are still valid, whether you sleep 8 hours. I mean, if you sleep less than a certain number of hours, it can be more challenging, but it's a really good window into whether a sleep disorder is present or not.
Mm-hmm. Good to know. I'm thinking of some clients that I've had where my instincts as a coach are on the high alert that they really do need that separate bed, and I think it's probably not as tough of a conversation in reality than it needs to be. And I think if you can talk to your partner and that your sleep is getting disrupted, and that there's an awareness of what that negative health repercussions are. I mean, I would want my husband to have a great night of sleep. He actually had to use a
100%.
CPAP for almost a year, and then it was like miraculously he was cured of his sleep apnea. But for that year, I mean, he was getting up shattered, drenched in sweat, because of course he was having, I guess, if I'm understanding it correctly, adrenaline reactions from like not breathing. His body would wake him up.
For sure. And I think, what I tell my patients is I give them permission to have these conversations, and I really challenge them on what it is that you are achieving with sleeping with your partner. And when you think about it, the benefits are, obviously the sexual relations, which you can still have whether you're sleeping in separate rooms or not. And it's the emotional closeness going to bed, and then the emotional closeness of waking up together. You can still make that a reality, right? You can start the night together in your bed, reading, talking, discussing. Then you can have sexual, intercourse if you want or not. You go into your separate rooms, and then in the morning you can have a touch base again to reconnect. So there are ways to still have the joys of sleeping with your partner, but yet still prioritizing your sleep if that's important to you.
Yeah, I think wasn't it maybe even 40 or 50 years ago or maybe it was longer than that, but you'd go into these houses and they would actually have like the separate marital beds, or like they would be in separate bedrooms.
Yeah, I think it's like in Victorian England, it was very common,
accepted,
like the noble families, the royal family, that was like very normal. That's what they did. They had separate quarters even.
Yeah. Okay, we're going back to the old days. It's interesting in this modern era of science and evidence that we're really starting to unpack some of the cultural norms and saying, well, does it have to be that way?
Does it have to be that way?
Does it have to be that way? Yeah. Let's talk about changing outcomes, right? From sleepless to restored, because I know this is really important for you. What are the evidence-based solutions out there? Let's focus on the positives. What can we do about this? We know we have poor sleep. How can we make it better?
Yeah, I think the number one thing is whether you have a bona fide insomnia diagnosis or you're not sleeping well, I think there are a lot of benefits from the CBTI program. So that's cognitive behavioral therapy for insomnia, which is actually the gold standard treatment approach for individuals with insomnia, because there's a lot of pearls in that philosophy and that delivery system that we can use every day. So that includes focusing on stimulus control. So avoiding things that are high stimulus. So your phone, your computer use, staying away from bright light right before bed, and really optimizing your sleep environment so that you are setting yourself up for success, which I'm sure, as a coach, you say this too, when you tell women to exercise, it's set yourself up for success as much as you can. In the same way that you would prioritize your exercise routine, you'd make it in your calendar. I'm going to the gym. I'm going to do this. It's the same thing with our sleep. So optimizing your sleep hygiene, your sleep behaviors is huge. And there's data to support that CBTI is actually more beneficial in the long term than sleeping medications and sleeping pills.
And as you said, I mean, the tools are, I'm working with this incredible neuroscience-based practitioner, Michelle Beatty, and I had her on the podcast, I think a year ago now, but she's working with my mother and my husband and I, and we're being proactive, right? Like, I'm really into being more preemptive, and the results are incredible. And we're learning about, how to notice our feelings and notice the shifts in our physiology, and how to regulate ourselves, and ultimately how to regulate other people, which is just leads to better interactions, more joy. So it's just huge.
Wonderful.
Yeah. Mm-hmm.
Other things that are helpful for women, especially if you're having symptoms related to hot flashes and night sweats, talk to your doctor about treatment. That may include hormone therapy. There are some great non-hormonal options out there on the market, and some new classes of medications that have been shown to improve your sleep and help your hot flashes. If you are struggling with depression symptoms, anxiety symptoms, please get treatment. That can be medication, that could be, behavioral counseling, psychotherapy, really to optimize your mental well-being. If you have a sleep disorder, we have to treat it, right? There's no amount of optimal sleep hygiene that's going to fix someone who has sleep apnea. It doesn't always mean that you need to rush out to get a CPAP machine. It depends on the severity of CPAP or sleep apnea, rather. There are some other options. Weight loss medications have been shown to be beneficial as well. Looking at your behaviors, I think, is a big one, and it requires a lot of, hard truths with yourself to think about what are you doing during the day that could be negatively impacting your sleep. The big ones, I would say, are caffeine. So a lot of people will often have caffeine late into the afternoon, which impacts your sleep. Alcohol is a huge one, and I really, really encourage women to take stock of their relationship with alcohol. In Canada, the guidelines changed a few years ago for all individuals, but for women especially, no more than 2 drinks a week, not a night, a week. And that's because of the link for women, especially between alcohol consumption and breast cancer. So, if you're going to cut down alcohol, do that for the breast cancer risk, but also it improves your sleep. We know that alcohol interferes with REM sleep. It is a sleep disruptor. It fragments your sleep, and you just don't get deep restorative sleep. And then the other thing, going back to a point you made earlier, is about timing of eating. So we really want to make sure that you're not going to bed right after you've had a big full meal. That can impair digestion, lead to discomfort. So generally the recommendation is 2 to 3 hours before bed. You really want to finish the meal and try to minimize late night snacking. And timing of exercise is important too. Exercise can help with sleep, but we wouldn't want you to do anything too vigorous right before bed.
And then there's cooling, right? So I know.
Yeah. So like if you're a woman who's struggling with hot flashes, maybe you don't want to try medications, and that's fine too. There are some mattresses that have cooling settings. I mean, some of the data we have is very preliminary, and hopefully over time we'll get more and more data. But anecdotally, I've had women tell me that it helps and they like it. And some of these mattresses allow for different temperature regulations for one side of the bed versus the other. So if you do choose to stay together, that's a strategy as well.
I know. I don't know if this is my Canadian heritage, but I love to have the room icy cold, and I love a nice snuggly duvet. Like that is. And if I don't have that option, I'm traveling, and I'm at a different house, an Airbnb, my body will find the coolest part of the bed. It just migrates to it.
Yeah. And I mean, you need to have that, again, going back to what we were saying about dropping your core body temperature right before bed to help you get into a deep restorative sleep.
Blackout curtains, things like that.
Yes. So again, light is a big one. We talked about the circadian rhythm. So if you are able to have blackout curtains in your bedroom, that's the ideal. If that's not possible, you can think about, eye masks can often help. Noise is a big one. So really try to make sure your bedroom is quiet. I mean, as much as you can. If you live on a busy street and, you hear lots of noise, you can think about a white noise machine. That can also help.
What about earplugs? Is that beneficial, or they kind of fall out halfway through the day?
I mean, it depends on each person's comfort level. I couldn't tolerate sleeping with earplugs, but if that helps you to block out the noise, you can try that as well.
And then even windows. I know in the house that we're getting redone, it's really important to us, because here in San Miguel, like noise is part of culture, and there could be a huge party going until 4 a.m, and it's cultural, right? So I can't expect the neighbors to. So I'm like, all right, we need.
It's like I'm prioritizing my sleep neighbor. Yeah, no, that doesn't go over well.
No. Beautiful. Sleep is a longevity lever, right? So we've talked about that a little bit in terms of how we associate poor sleep with disease. Is there any data to support great sleep with really great health outcomes?
Yeah, so we don't have necessarily health span data that from the last time I reviewed the literature, but we do have mortality. Not yet. We do have mortality data. So those two components of sleep are, the sleep duration, 7 to 9 hours, and sleep regularity. And in fact, the American Heart Association just a couple months ago said that those are really, really important markers for cardiovascular health at the same level as optimizing your diet, at the same level as exercise. So it's really showing you that the data is there. We know that the interplay between poor sleep, cardiovascular disease, metabolic disease is a big one. And, for the longest time, this was never talked about. Sleep was I make a joke, it was a sleepy science, right? Like didn't really have our prime time, but I think that's changing. I think with the focus now on longevity, health span optimization, we're seeing the links and the common thread that sleep really just weaves everything together.
Yeah, I think there's a lot more sleep quality. Maybe it's the algorithm, but I see that appearing a lot more on my feed. And I am in the fitness and wellness industry, and I feel like every expert I talk to, it's the same. It's always the same. You got to get your fiber in. You got enough protein. You have to get your sleep. You have to work on your recovery. You have to build muscle mass. Like it's and the diets that support that, the lifestyle that supports that, they all agree on the same thing. Like, don't smoke, limit your alcohol. Make sure you have cardiovascular health. We were talking about that earlier with Dr. Amy Bayless. Yeah. What about the future of women's sleep care? We touched about a little bit, but techs, wearables, that research gaps between men and women.
Yeah, I think that the thing that I would prioritize first would be really having sex-specific outcomes in sleep data. Looking at, sleep apnea research focused exclusively on women's health, making sure that all the algorithms that we're using on all our wearables have sex-specific markers as well, and not using a blanket algorithm for men and women, really just teasing out the influence of, our hormonal journey, whether that be, from menstruation to pregnancy, postpartum, menopause, like all of that needs to be front and center in all of these wearables and all of the tech and AI. And then the future, I think, also is really educating practitioners. So really starting at the ground level, making sure that it's, women's sleep, women's health is educated from like first principles in medical school, in nursing schools, in pharmacy schools, and all of the healthcare providers. To your point, it takes 16 years for information to get disseminated. I mean, medicine and healthcare education is a long cycle. So we need to start with a fresh group of trainees and make it the norm, rather than the exception.
Yeah, we definitely, and it's shifting, but we definitely need more doctors trained and physicians, let's say healthcare practitioners trained in women's health. And sleep is definitely a very, very important lever that's not really prioritized, and that needs to shift, but also at the research level and at the consumer level, right? 100%. Like products that work. Do we have FDA approved tech yet for pursuing sleep, whether it's for men or women?
Yeah, and not that I'm aware of. I know that a lot of my patients come to clinic with all of the newest wearables, and we go through it together, whether that be the Apple Watch, the Oura Ring, Whoop. I use it as an education opportunity, right? To really go through each patient. I look at the impact of late nights, of alcohol, of late meals, and we can actually see the data in real time. I always preface with patients, though, is try not to get too wound up in the numbers, because oftentimes it can have the opposite effect where you develop what we call like sleep-related anxiety because you're trying to optimize your numbers, and that in and of itself can create anxiety, stress, and then you're not sleeping. So you have to find that happy medium. But yeah, there is I think the future is bright. I think it's coming. It's just it can't come soon enough, I guess. For me.
What are the three to five key evidence-based strategies that you'd like the listeners to walk away with? Of all the things we've covered, I feel like we've covered like 15 things.
We covered a lot. I think realistic things that women, men and women can start doing is protect your sleep time. Really think about it in the same way that you prioritize protein in your diet, the way that you prioritize exercise, mental well-being. Really think about sleep as another pillar that you prioritize. Number 2, be really mindful of your electronics use before bed. listen, I'm not perfect. I sometimes am there scrolling. We talked about this before, like half an hour, 45 minutes.
The
and
cat
I'm like,
videos.
the cat videos, this is what I do for a living. Why am I, online? It's okay. We're human. And, if I always say sleep is like the land of infinite second chances. Tonight was a bad night. It's all good. Tomorrow night, I'm going to try to do better. So really trying to be mindful. And this is a great opportunity if you have kids in the home, teenagers in the home, bring them on board with this sleep journey with you, because I think they're a generation that is really going to need it. They have grown up with these devices, whereas we didn't. And so really showing them by example that you need to have a digital sunset in the house. So everyone puts their phone down.
I love that.
Down.
Digital sunset. Great catchphrase. Beautiful.
So that would be number 2. Number 3, we talked about alcohol. So I often talk to my patients about trialing
it's such
alcohol
a loop, right? Because I need the drink to relax, to go to bed,
well,
especially if it's anxiety and career stress or kids or whatever.
100%. But, I would say try a 2-week alcohol-free period, right? And really be honest with yourself how you're sleeping. You'll often find that you're sleeping better. So think about ways that are there days in the week that you can not have alcohol, and then prioritize your sleep, maybe during the work week. And then on Saturday, Sunday, you can loosen up a bit. That's another option. We talked a lot about having the conversation with your partner about perhaps for a few nights you try sleeping in separate rooms if that's available. And then the last piece is you don't have to do any of this by yourself. Find a friend, find an accountability partner, find a neighbor, a workout buddy, and do this together and have accountability with each other. Check in with each other, I think would be the last piece of advice.
Those are definitely easy 3 takeaways that people can implement today. And I hope people listening to this conversation here are going to be empowered to really address this, right? Like, I think of Tony Robbins and the pain pleasure. I think for too long, women have not associated radical pain with not getting great sleep. And like so many other things that we've accepted as, well, that's just normal. And we have to really shift that conversation and say no. And that's, you have to vote for yourself. You have to understand that you can have radically optimized health. I think it's also wonderful to know that a lot of the major lifestyle levers that you would pull for sleep health are going to also cover you for cardiovascular health, cognitive health, musculation, et cetera. And that we do have a lot of pharmacological interventions, and we do have some fantastic doctors and experts who can really help dial this in. So you're not on your own. You might have to work a little bit, right, to get to those doctors, but they are there, and you got to fight for it.
Yeah, that's wonderful.
Thank you so much for being on the show, Dr. Woganee Filate. Practicing that name again.
You got it.
And I'm going to see you next. I'm going to see you next week, right?
Yes, at the National Menopause Show in Toronto. So
perfect.
Excited.
Are you going to have a booth there?
We will have a booth. I will be there both Saturday and Sunday. I'm speaking on stage on Sunday, and it's a really, in my opinion, tangible strategies that you can use to really get your sleep back.
Perfect. Now, this podcast is going to actually drop after the show, the menopause show. So if people wanted to pursue with you afterwards, where would they be able to find you? Want to talk about your clinic a little bit?
Yeah, you can find us. So I work and I founded with some co-founders of mine, women's specific health and wellness longevity clinic in downtown Toronto called Lume Women's Health, Lume. You can find us online at Lume Women's Health on our Instagram. And if you want to follow me for more specific sleep tips, you can also follow me at Filate MD.
Perfect. Thank you so much. And we'll see you next week. We'll see you at the show.
Yeah. Thanks, Michelle.
Bye. Thank you so much.
Bye-bye.